Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. This is of a patient with a blocked left ear, and you can see that the ear canal is quite swollen and inflamed. They've got a condition called otitis externa. Otitis externa is an umbrella term for an infection and or inflammation of the outer ear, and in this particular case you can see the swelling, the edema, and it's just making it a bit difficult for me to insert the suction probe. So this is a standard Zollner suction probe into the ear. The diameter of the suction probe, so this is the external diameter, is I think it's 2.2 millimeters. So you can just see how narrow the ear canal is. Most people's ear canal entrance is around 5 to 6 millimeters in entrance. It could be a bit more than that, if truth be told. I would say there's loads of individual difference, but between 5 and 8 millimeters. And this wax, it's also a lot of skin and it's crusted. It's almost crystallized, and it extends all the way to the patient's eardrum. So again, I'm just trying to get access into the ear. When you've got swelling like this and you introduce a suction probe into the ear, the sucker tries to inadvertently suction the fluid within the cell. So when you've got swelling, it's a buildup of fluid within the cells, and that fluid is attracted by the suction from the suction probe. So it draws in towards the suction probe, which then it closes and collapses the ear canal. I think I'm going to try and use another instrument soon. I think, here we are, Jobson horn. But with the mechanical instruments, it's quite hard to get inside the ear because it's so narrow in there. And when I'm using the Jobson horn there, what it's actually doing, so although the surface of this wax is quite dry and crusted, the core is quite soft, and the Jobson horn, when used, it embedded into the core of the wax, and as I was trying to retrieve the Jobson horn back out, it almost spread the softer core, almost like butter on toast. So I've just gone back to the suction for the moment, and I can feel some resistance when I was suctioning very deep in the ear. You can feel that there's something attached and it's not letting go, and you have a better view now of this skin layer at the base of the wax plug. So this skin is attached, it's like double-sided sticky tape. Not only is it attached to the underneath side of this wax plug, but it's also attached to the canal wall. And so I just use some olive oil spray, and slowly but surely we're bringing this out. And that gives you a good view of how narrow the ear is and how swollen it is at the entrance. They do suffer from chronic otitis externa. You can see the patient's been scratching the ear on the left-hand side of the canal wall. It's with their fingernail just to relieve the itch. So I've got the large plug out there, and we've just got a smaller secondary plug to remove. Actually, it's a bit larger than I thought on appearance. That's the patient's eardrum, nice and healthy. You can also tell by the ear canal, the incline, there's quite an inclined ear canal. All of our ears, well, in adults at least, the ear canal does go up around 32 degrees on average, but I would say that patient's left ear goes up a bit more. This is their right ear. You can see it's a lot wider, so although they've been scratching, that you may have seen a bit of a scratch there, but this ear canal is far wider. So because we're quite lateral, I mean, this wax wasn't actually causing the patient any problems, but since they were here, we just removed it, and I'm just using a Jobson horn here. I don't want to introduce any suction if not necessary, because when you perform microsuction, there's always risks. There's risk with any mode of earwax removal, but the suction noise is quite noisy. It's a lot noisier than people anticipate, and whenever I'm performing a procedure, I do explain that. I always explain that we're going to vacuum the ear, and it's going to be noisy and probably be a bit more noisier than you're expecting, just so they're not surprised. Quite often you introduce the suction noise in the ear and the patient jumps because they're a bit surprised by the noise. And if you have prolonged loud sound in your ear, it can lead to what we call a TTS, which is a temporary threshold shift, so a temporary reduction in your hearing. And in the worst case scenario, a PTS, a permanent threshold shift in your hearing thresholds, which obviously we want to avoid. And it can exacerbate pre-existing tinnitus. So tinnitus is a noise that some people experience or sound within their ear or their head, which is not due to an external stimulus, it's an internal noise. So loud sounds can exacerbate that, or if you don't have tinnitus, it can cause it. So we've got to be careful. You've got to select the right instrument for the right job. And in this case, because there is no symptoms there, I just wanted to avoid any suction for no reason. So you've got this thin layer of wax at the base. We're just trying to, again, we're just going to try and hover over it, but I'm not too concerned by that. A bit of wax is actually healthy for us. So you can see we've got a bit out there. I hope you enjoyed that video, guys, and you're all keeping well and safe. And yeah, do stay tuned. And remember, be nice and be kind to each other. Thank you.